No, somebody who's the shyest person in the room.
Melissa. Or Callie.
Callie. Here you go. Come on up. Okay. First of all, I need to hit a few administrative highlights. Does she have permission to touch your body? Does she have permission to expose parts of your body? Okay. Alright, go ahead and relax. Cross your ankles. Relax. There you go. You're dead. Alright. Have you ever used an AED before?
No.
Okay, go ahead. Okay. What I'll preface this by is they've designed them where, yes, why did you go to the green button? Because green means go, right? Anybody that knows colors and can match it with step number 1 means push green. From there on out, just follow the prompts. Push it first.
So bad, dude.
Apply pads to patient's bare chest.
Wow.
In pad connectors next to flashing light.
It will continue to talk to you until you do what it asks you to do. So don't panic going, oh, it's still talking. Okay.
Apply pad.
Where does that one
Plug-in
go?
connector.
Right. Here, go ahead and peel it off and stick it there.
Oh, no. Yeah.
Right?
You're about to get whacked.
Plug-in connector.
Right here, no, lower, just below the ribs. Oh. There you go. And it says plug-in pad connector by the flashing light. So
Analyzing heart rhythm. Do not touch the patient.
if you touch him, it'll pick up your heartbeat. So don't touch.
Shock advised. Stay clear of patient.
Don't touch the patient, because if somebody's touching him
Deliver shock
while the
now.
shock is being
Press
delivered,
the
you will
orange
get
button
shocked
now.
too. Go ahead.
Shock delivered.
Great.
Begin CPR.
Okay. What's going to happen as soon as the shock is delivered, as soon as someone pushes that button and the body's clear, somebody immediately needs to get on the chest to begin compressions. Because in effect, the AED stops the heart. Doesn't kickstart it, nothing. It stops it. And your application of compressions will restore normal rhythm to it, hopefully. Okay? So this thing's got a timer in it for 2 minutes. You're going to do compressions, 30 to 2, 30 to 2, 30 to 2. For how many cycles? 5. And then it's going to say, stop. Analyzing. Nobody touch the patient. And it'll continue to do that until it's figured out what the patient actually needs. Now, what if, when we opened his chest shirt here, he was just, Grizzly Adams? I mean, fur deluxe. What would you do? You wouldn't get a good patch seal, would you? And in fact, if that pad is actually sitting on a cushion of hair, it will actually, the electricity will come out from underneath, create an arcing phenomenon. It'll burn all his hair off, and that's no longer an issue, okay? But it will burn him. So if that happens, you've got somebody who's got a fur pelt on, you mash the snot out of the pad and then just pull it off. Do that with both of them. And then put a fresh set on the bald spots. EMS, where's the little cover things for these? Yeah. EMS doesn't waste their equipment, we use duct tape.
Oh,
Works good.
just rip it. Just do it.
Gotta find the edge first.
No.
Now.
Apply pad. Plug-in connector.
And as soon as you notice that we took the pads off, it recognized the error. And so it will actually, if it's not getting a good connection, it'll say, poor pad placement, apply pads. And it'll keep telling you until you actually have a good connection.
Plug-in.
Okay? Now, thank you. Now,